Hello and welcome to Doctor Story. For nearly 2 years, the COVID 19 pandemic has thrown countless curveballs at the world and it shows no sign of stopping. Enters Omicron, a new variant that is spreading quickly, threatening to replace the Delta variant as the dominant strain in several countries. Towards the end of November, COVID 19 infections in South Africa began increasing steeply. While studying the spike, scientists came across a new mutation on November 24th. Does COVID's Omicron variant poses a very high risk? Do we need to fear Omicron? To answer all our queries, we have with us today Dr. Deepak Subramaniam, one of the leading surgical gastro consultant of our country.
Dr. Subramaniam, a very good evening and yet again, welcome to Doctor Story.
Hello, Ansel. How have you been doing?
I've been wonderful. How are you?
All well, thank you.
So, Doctor, starting with the Omicron variant, let's understand the symptoms of Omicron.
Yeah. So, see, we're now again basing all our symptoms of Omicron variant based upon the Western countries where it has affected before it has come to India. So, the symptoms which I hear and from many friends as well as in the media, what we are hearing is it is almost similar to the earlier variants. The only difference is here the patients do not have any high grade fever like what they had then, and similarly the weakness, the body weakness and the body pain is not as high as what it was then. The difference is also here common cold, which is running nose and sneezing and other things, have become one of the common symptoms of Omicron, which was not in the earlier two waves that we faced, wherein their fever and cough was predominantly one of the main symptoms. And if you had probably a common cold, it was actually disregarded as probably COVID. But here in Omicron, that has become one of the significant symptoms in people who are affected.
So, looking at it from a different perspective, if the only symptoms of this variant are, cough, we talked about tiredness, we talked about runny nose, can't it just be a flu? Like, because it's communicable, it's contagious too, there's weather change, thus it's widespread. So, why is there a need to be, tested, or how different will someone feel if one is affected by common cold versus Omicron?
See, there is a huge difference when it comes to common cold and Omicron, because in common cold, even from a younger age, you would have probably been exposed to it, and you have kind of, you don't have your symptoms may not become worse, but there is a possibility in Omicron, even though we say the symptoms are very mild, there is a subset of patients who may still have severe degree, moderately severe degree, or severe degree of the illness. So I don't think we can say this is just a simple flu and move on, because this can affect the lungs in people who are immunocompromised, in people who have in people who have not been vaccinated, because a significant proportion of people have not been vaccinated. If you look at it in the Western countries, most of their population is vaccinated. In fact, in many places, even the booster dose has been administered. But here, even completed 2 doses of vaccination in India has been less. So we don't know the effects on people who have not been vaccinated at all. So there should be a very clear distinction that this is not a common cold or a flu. This is COVID variant, but it's called Omicron. But it is on the milder variety in what we see and what we hear. But what happens in India is something which only in the next few weeks we are going to know as to how severe illness is going to be.
Exactly. So in comparison with the original virus and then the Delta, now the Omicron, is Omicron more dangerous than the other variants?
It is not dangerous because it has mild symptoms. It is dangerous because the infectivity, that is, if probably in the first variant and in the Delta, if I was wearing a mask and the other person was not wearing a mask, the chances I could develop this virus was less, because I was wearing a mask, the other person wasn't. Here the problem is, it is so common that you speak to a few people and in a crowd, you're standing there for a few minutes. If it is present, it is infecting people. So the infectivity rate is very, very, very high. It's actually in all the 3 waves, this is going to be the most infective variant when you look at it. That way, it is going to be very dangerous. That is why if you look at it, the numbers in India, even though Omicron has entered India, say about 10 days, 12 days back, the numbers are actually steeply rising in all the countries. I'm sorry, in all the cities, at least the major cities where international travelers are landing. There is a lot of domestic travel that is happening, crowded places, cities, all these places. Delhi is one of the worst affected, is what I hear. So even though it is a mild illness, the numbers are very steeply rising. That way, it is very, very dangerous. But if you look at it from a mortality rate or from ICU admissions, people who became sick, or from a perspective of the lung percentage of lung that was affected compared to the previous variants, yes, this is less dangerous when you look at it from studies as well as what you read from the media. But you never know. I mean, one has to be careful, and one has to be extremely vigilant in terms of protecting themselves.
So if it's all about the infiltration of the virus, then what should we do differently to protect ourselves against Omicron?
Nothing, actually. So if you look at it, COVID itself, I think the whole thing is based upon protecting yourself with a mask. You protect yourself. Mask is become your shield, and that is what you need to wear always. And in fact, there have been times in the previous waves, or in the first wave or the second wave, in the restaurant, when you go and sit in a restaurant, people just remove the masks. But with the current wave being at its peak, I don't think just when you probably are eating your food is when you need to probably remove your mask. The rest of the times, I think it's better to wear your mask at all times. Mask is the only mode of protection, and of course, other than mask, is of course vaccination is the most important. Still, many people in India here are yet to get vaccinated. So get yourself vaccinated and protect yourself with masks. Avoid unnecessary travel. If you can avoid it, and do a web meeting like how you and me are doing, we could do the same interview in person, but we decided to do it in a Zoom call. I think if you can manage things like that, that's the only way to protect ourselves from Omicron. And that is the same from COVID beginning in 2019. Those principles don't change for Omicron.
So, doctor, when we talk about mask, there's just a question related to the mask. Which mask do you think is the best? Because people have shifted to, cotton mask or fancy mask, and there are a variety of masks going on in the market. Which one is the actual, the one that would work against the virus?
See, healthcare workers like us, who are probably exposing ourselves to patients to various degree in the hospitals, we wear a N95 mask. Okay, the N95 mask gives you as much as 99% protection from this. That said, the simple blue color 3-ply mask or the green color mask which you wear around gives you reasonable good protection. And if you look at it, the cloth masks which we are using reasonably give you a reduced protection compared to these two things. But something is better than nothing. I don't expect our general population to go wear a N95 mask or a 3-ply mask, because the availability and the stocks are also not great. So, and it's also a little bit on the costlier side. So a cloth mask would be the most cheapest option that could be available. But it's much better than just not wearing a mask. So some protection is always better.
Absolutely. So, doctor, about its treatment, how does that differ for a symptomatic patient versus an asymptomatic patient?
Again, if you look at it, it's very, very similar. The treatment protocol has not much varied, because primarily the COVID variant, or how much ever the mutations that are happen, the primary treatment for COVID is kind of the same, and that has been stuck as much as it is. If you look at it, if people who are symptomatic, we do a few blood tests to check the severity of the illness. Whether the CT chest is done routinely on all patients right now, because it's a very mild variant and it's not affecting the lungs, is something which we need to ponder upon, because not every patient might require a CT in this particular Omicron variant. So if you look at it, the treatment kind of remains the same, antivirals, the same medications which may be used, but the severity of the illness being low, you might not be using the same remdesivirs or the other things which we are used to speaking about in the earlier waves. We probably will limit ourselves to a lot of symptomatic treatment, and see if the patient is progressing well with those medications itself. I think that should be the treatment that should be offered. Of course, in asymptomatic patients, really there is no treatment that is required. And for answering your question, because they don't have symptoms. They just, they ask them to isolate them, and then you watch for symptoms and keep checking your oxygen saturation levels. And those principles remain the same, whatever the variant that is occurring.
So finally, how worried should we all be about this Omicron then?
See, it is worrisome because, as I said, the infectivity is high. But I don't think it should really affect your day-to-day activities as long as you're following principles. The principles, namely, again, I would like to emphasize that: wear your mask, avoid unnecessary travel. If you're not vaccinated, get yourself vaccinated. These three are our main, the ways to win over this virus. We hope that this will be a short-term period. The rise might be quick. Similarly, the dip might also be very quick. The other thing about this particular illness I want to emphasize is many people might not go and get themselves tested, because if the symptoms are similar to a common cold, you might just think that it's a common cold. People might not even go get tested, and they might be going about their normal activities. So that is something which people should be aware of. In this particular variant, they should be aware of the symptoms, so that they are aware that probably if these symptoms are there, I may be suffering from it, and probably get themselves tested more, so that if they get themselves tested, they are sure that they have or they do not have the virus, and they can isolate themselves better. So not to worry about much, but be safe and wear your mask and stick with your principles as from 2019 for COVID. I think we should win over this virus soon.
Well, it's much of practice now. It's 2021 already, 22 already.
Absolutely.
Yes. Well, with this, it's time to put an end to our discussion, Doctor. Thank you so much for taking out time for us. And we really got a deeper insight into the virus and its treatment. I hope it certainly helps our viewers be, better informed and less panicky than before.
Definitely. Thank you so much. It's always a pleasure talking to you. You take up the topic at the right time, and I think this is the right time to educate the general public on Omicron before it becomes even worse. Thank you.
Absolutely. Thank you so much.